Good morning, everyone. I'm Mark Weeks, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Trauma-Informed Clinical Supervision. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Offices of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will be able to view your name. You will only be able to view your name. If you have any questions, please send them to the presenter and me, the host, by using the Q&A panel or the chat panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the Q&A panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you are experiencing poor computer audio, there's a few options to try on screen right now, and these options are posted in the chat panel as well. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone option, I will call in. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be on the FATA website within 30 business days. A helpful hint, the archived video displays what looks to be an error message but is just a delay buffer. Ignore it and hit play, and enjoy. To access the recording and PowerPoint, go to www.fata.org, Resource Center, Training Library. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides personal digital journals where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will redirect everyone to an evaluation form on the FATA website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FATA as part of this remains confidential. Statements of credits will be posted within 30 business days after the evaluation closes in the individual personal development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note the evaluation will close midnight on Friday, December the 13th. 1 to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, the Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include Florida licensing numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you do not need to provide your certification number when you register with our site. Note, please, that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide contact hours or a certificate of attendance if you do not attend the entire webinar. We are not permitted to provide partial credit. Elizabeth Guroff is Director, Trauma-Informed Services. She is a licensed clinical marriage and family therapist and approval clinical supervisor in Maryland with over 25 years of experience in behavioral health fields as both a clinician and administrator. Elizabeth has worked in a range of clinical settings for treatment foster care and in-home treatment programs to outpatient mental health, private practice, and community-based adult services to a variety of residential settings for children and adults. In all of these settings, Elizabeth has provided direct clinical services and provided clinical supervision and direction in all of these areas. Most recently, Elizabeth was the COO of a large mental health provider in Montgomery County, Maryland, where she oversaw and directed the implementation of TIC practices across the entire agency, as well as the clinical supervision at Behavioral Health Clinic in Columbia, Maryland. And with that introduction, I'm going to pass the presentation over to Elizabeth. All righty. And Elizabeth, you're still muted.
Can you hear me now?
Yes. All right.
Okay.
And you should have you now have control over the presentation.
Okay. So welcome everybody. Today we're going to be talking about trauma-informed supervision, and also not only just supervision for anyone, and we can definitely use the trauma-informed lens as a supervisory tool for anyone in our practices. We're also going to be talking about it through that clinical lens. So as we get started, we want to remember that vulnerability is really that birthplace of innovation, creativity, and change. And as clinicians, we need to be able to access all of those resources as we do our work and as we work with clinicians. So today we're going to be going over the trauma-informed care principles and how you can integrate those into your current supervisory practice. We're going to talk about the use of trauma-informed supervision notes, as well as a trauma-informed supervisory disclosure form, and the use of that in a supervisory relationship. And then at the end, I really want you guys to start looking at and thinking about, through today's presentation, what are we talking about that really aligns with your current practice and that you want to keep continuing to do as you modify things? What are you kind of on the right track with? And if you adjust your supervision style or practice in a certain way, it will get you further along that trauma-informed implementation process. And then what do you want to really start including or stop doing to really increase your supervisees' engagement, satisfaction, and also their clinical outcomes, which is the reason that we're doing all the work. So a reminder, as we're talking about trauma-informed care and the impact, is that trauma can be very triggering for all of us. Trauma is a human experience. It isn't something that just happens to specific clients. It's an experience that we've all gone through in different ways. And so how do we make sure that we allow, both in this presentation for yourself, as well as in your supervisory practice, those disclaimers to those that we're supervising, the ability to take a time out or break if we're getting triggered or the information is overwhelming, recognizing that we need to listen more to understand and kind of step back from the practice that we frequently have of listening to respond, and really respecting and creating a space for all those different perspectives so that we can continue to learn and grow. So let's start with this question. Really want to start thinking about, when is the last time at work you experienced joy? Last month I was down in Florida, and we really talked about in the room this idea that we spend half of our adult life at our workplace. And part of that piece is learning to find joy and engagement in the work that we're doing, in the colleagues and those that we're working with, and making sure that that is absolutely part of not only our practice, but as supervisors creating that space and really asking our staff about that as well. So let's start with what are the basic trauma-informed care assumptions. The first piece as supervisors that we need to recognize is that our staff aren't a special separate group of humans, but really trauma-informed care principles apply to everybody. And so instead of separating and looking at the needs of the client separate from the needs of the staff, as a supervisor we need to recognize that everybody, staff, our clients, and all of those that we come into contact with every day at work are really doing the best they can with what they have. that symptoms are really adaptations for coping mechanisms, that trauma survivors, that experience really shapes, our experience of trauma really shapes our beliefs about our own identity, our worldview, and our spirituality, or how we make meaning in our world. We want to implement trauma-informed universal precautions or universal expectations across the board. And so now when we look at this from a supervisory perspective, how do we walk into our supervisor relationships with the expectation that our staff have been traumatized as humans, and that our goal is to not only not re-traumatize, but really to create an environment in which they can thrive. Recognizing that there are times where we can share, our staff can share those trauma perspectives as they collaborate with their clients, but really in this webinar focusing on these last 2 points, that our staff really need support from one another as well as from us, including respect, information, the ability to connect with those around them, and also our job is to help provide hope and create that safe space for our staff to really explore their own vulnerabilities and reach that other side where they can be creative and open. And then recognizing from a compassion, fatigue, burnout, secondary trauma perspective that the work that our staff are doing can impact them and affect them. And so how do we create in our supervisory relationships the expectation that things are going to happen and impact our staff, and a safe place to really start talking about that impact? So on a really brief overview of those trauma-informed perspectives, right, it's really moving to understanding what has happened to someone and what is strong with them. So now when we take our supervisory lens, how do we start, as opposed to working with staff on the problems and the things they're doing wrong and the things that are coming up, but really starting with the strengths that our staff bring and building off of that, as opposed to looking at kind of a deficit model of supervision. This is the recognition that we really need to have universal expectations, that we need to expect that all humans, those that we supervise and those that we serve, both in a supervisory capacity as well as our clients, have already been traumatized enough, that we expect everyone to have experienced, unfortunately, some traumatic event. And how do we then respond in a different way? We also need to recognize as a supervisor that part of our goal is not to just treat staff how to work with the dimensions of wellness with their clients, but as a supervisor, how are you bringing in the 8 dimensions of SAMHSA's wellness here on the screen into your supervisory practice, whether it's part of helping develop an organizational culture and opportunities for our staff to maybe have access to financial planning and support in those areas. On that social side, that connection, how are we providing opportunities both to connect with us as supervisors, but also a collegial approach within our organization, and really establishing all of these different areas that we're supporting our staff in terms of wellness and growth. The other section or thing that we want to really think about is trauma-informed care is an organizational culture practice. It is not just focusing on the one-on-one relationship and intervention that our staff use in the clinical room and clinical space with clients, but really it's an organizational culture that recognizes the impact on all humans that we interact with. So how do we help move our organization as supervisors from being organized around trauma to becoming trauma-informed and developing that understanding and shared language and training and supportive environment, to moving to really becoming an overall healing organization? And what you'll see in some of these practices of being reflective, collaborative, a culture of learning, the idea that we make mistakes here, and how do we learn from that? If we create an environment as a supervisor that we're perfect and we expect perfection from our staff, it's really a myth, and we really set people up for failure, because the truth is we learn a lot more when we fail and we try again than if we just are perfect every single time. And it's just not reality that any of us, including ourselves as supervisors, are going to be 100% every time we're doing an interaction or an intervention. So how do we create that really strong culture of learning is going to be really important in terms of embedding your supervision practice within those healing organizations. The other thing we want to think about is this quote from Viktor Frankl: "What is to give light must endure burning." And recognizing that our staff are giving of themselves every day in order to help and be present and engage our clients in the hard work that they're doing. And so how do we support them in building up what they've given away? How do we help support them in addressing compassion fatigue and really helping make sure they stay in a compassion satisfaction place and recognizing all of what they're giving up of themselves in order to be present and really get the strong outcomes that we're seeing every day? And so if we recognize that, we recognize the importance of our supervisory relationship in really building on our staff's strengths to help them be present with their clients. So from the Center of Substance Abuse Treatment, we have this definition of supervision. So first piece is that relationship over time. And as we get into today's webinar, we'll also do some work and look at Brene Brown's work in Daring Leadership. So this relationship, and what she'll talk about is really the importance as a supervisor that we have a positive connection, that we like our staff and feel connected to them. And really, if we as leaders are not connected, do not enjoy, do not like the staff that we're supervising, we really need to either build that relationship with them or find someone else to lead them. And really looking at the idea of an ethical supervisory practice, if we're going to really be honest and present and support the staff that we are supervising, that we have to have a positive relationship with them. So developing also that atmosphere, that learning atmosphere focused on growth, professional development, that idea that we really need to build the strengths and professional growth of the staff that we're supervising on an ongoing, continuous basis in supervision. Building those healthy, cohesive teams. As we look at the trauma-informed care principles and recognizing the importance of bringing all of those principles into the development in our supervisory relationships as well as the teams that we oversee to make sure that we're really operating in a trauma-informed community and culture. And then making sure that there's quality improvement, successful implementation of those evidence-based practices going forward. So it's really important, right, that we are present, that we help mitigate that burnout and vicarious trauma, that we are helping address, identify, and educate our staff in their understanding of trauma-informed care principles to really help move our organizations forward to create that entire trauma-informed culture. So let's talk about how and start getting into how these really start to align with trauma-informed care principles, right? The idea of transparency, that our actions are open and honest. If we don't know the answer, that we let staff know that. If information is brought to us, we make sure we're following back up, recognizing those different levels of responsibility, but not really doing things for people or to people, but really moving to a place of doing things with people in a very collaborative way. Making sure that trust really is at the center of our relationships and really the importance of that, right? Focusing on professional development. We'll talk later in the webinar about the importance of having, on a professional development side, at least one goal in our staff's focus areas that is not directly related to their job description, but really what brings them alive and areas that they want to grow personally or professionally, and then helping find creative ways to bring that back into the work that we're doing. So as we're working on our own supervisory model, regardless of what supervision practice you're looking at. We want to make sure that we have not only our own clear theoretical orientation to the work that we're doing so that we can speak from that place, but that we also help our staff develop their own theoretical orientation and understanding, if we're talking from a clinical perspective, right, what causes change and how does that, from my personal professional perspective of change, how does that then drive my theoretical orientation? And then how does that align or not align with the work and the evidence-based practices that you're using at your organization? So helping people really be clear about that is a very important component of being a trauma-informed supervisor. Education about the symptom management, common responses to trauma, so that our staff can be really on point with what they're seeing and really help with proper diagnoses of what they're seeing in the clients that they're working with. Making sure that we're focusing on the therapeutic relationship, both within the staff's relationship with their clients, but also in our relationship with our supervisees. Making sure that we maintain safety and respect so that they can bring to us really those really difficult places that they're in, so that they're not feeling like they have to hide their difficulties, that they have to hide who they are, but they can be genuine in their relationship with us so that we can really be in an honest, open environment and help people grow and support them when they're struggling. As a supervisor, you are the catalyst. Your job is to walk the walk and to talk the talk, right? We have to make sure that the talk and the walk are matching because our staff are looking to us. That we can say one thing, but if we're doing something else, we're really not being open and transparent and building those genuine relationships. We need to recognize in the supervisor relationship that there is a power differential. We're determining at times if people are getting their licenses, if they're graduating, if they're interns, if they're getting promotions or raises, and really driving the direction sometimes of the work that they're doing. So being really aware of that is going to be very important when we move to trying to really be collaborative and leveling the playing field in our supervision with our staff. So how do we manage that? How do we openly talk about that? And allow our staff to identify and find their own supervision, their own clinical practice, their own theoretical practice, as opposed to just adopting ours because we're the supervisor. Making sure that we're visible and present on the floor and really looking for those teaching opportunities, whether we're using ourselves as examples, which can be a very powerful tool, but also creating that environment, as I said earlier, that we make mistakes here and things are going to happen, and kind of how do we walk through that together. So this is the National Council's Trauma-Informed Supervision perspective and framework, and we're going to walk through this today. We're going to start with trauma-informed care principles and then move into fostering that supportive environment, and then some components and skills in that supervisory role. So first of all, here are the trauma-informed care principles. And so let's talk about kind of how they start to work their way into your supervisory relationship. So safety, right, throughout the organization, that staff and the people that they serve, whether they're children or adults, feel physically and psychologically safe. That the physical setting is safe, the interpersonal reactions promote a sense of safety. So how are we addressing staff feeling safe in the environment? If they're community-based, making sure that they're not going into an environment that they don't feel unsafe in, making sure that people have those resources, making sure that the offices are set up to have easy access to exits for both staff and clients. In addition to that, and that physical space, really modeling safe and secure cultural values, really creating compassion and vulnerability and empathy is a way in which we do our work. Developing positive work culture components, looking at that wellness wheel and creating an organizational culture of wellness. But then also, are we as supervisors creating a space that's not labeling and blaming and shaming and not re-traumatizing our staff, but really a place that feels welcoming, the staff can let their guard down and really explore all the different components of the work and the impact of the work on them with us. So these are some of those things that we need to do. Recognizing the parallel process. Session rating scales is one way to start that dialogue about how our supervision process is going, looking at evidence-based relationship practices, and really looking at our relationship with our staff as an open dialogue, and then also looking at the relationship between the staff and the client and giving a space for everyone to talk about all of those things. Trustworthiness and transparency talks about the organizational operations and decisions, that they're conducted in this transparent way, and that the goal is about building and maintaining trust with our staff and others involved in the organization from that supervisory perspective. You see a nod here to Brene Brown's work in really recognizing that clear is kind and unclear is unkind. So how can we make sure that our expectations are measurable, that those measuring outcomes are really created with our staff? We have open and honest communication, that our staff have training and knowledge about evidence-based practices, that we work on conflict resolution, recognizing that we're not always going to agree on everything. And so how do we recognize the need for conflict at times and really support walking through that in a healthy way? How do we allow for 360 reviews for our staff to review our supervisory practice and making sure that we're really meeting their needs as well? Brene Brown also talks about the idea of painting things done, and how do we make sure, that we're really clear with our staff about what the end product would look like, and then allowing our staff space to get there in their own way. The importance of consistent meeting times and doing things together all fall under those trustworthiness and transparency principles. So here are some ways to really elicit that feedback, making sure that we're clear about what the outcomes and the expectations are, developing that supportive learning environment, really believing that people are struggling with skill, not will, and from Stuart Ablon's work, and believing that people can learn and grow and change if we just provide the environment in which we can do that. Recognizing that feedback really needs to be supportive and engaging as opposed to seen as punitive. And then the more specific we can be with our staff about what we'd like them to improve upon, being very clear about examples without having that negative shaming, blaming, and labeling staff in a negative way to really create a growth opportunity. And then as supervisors, conflict's going to occur, whether it's conflict with our staff and their relationship with us, or a directive or an area we're needing to head into, or with each other. How do we create an environment where it's recognized and understood, but create skills within ourselves and with our staff to really resolve conflict and look at that as a learning opportunity, and move away from those judgments? The next principle is collaboration and mutuality. So how do we partner, and leveling that power differential between staff and ourselves as supervisors organizationally, Demonstrate that healing occurs in relationship, and that importance of really liking and engaging with the staff that we supervise. And if we don't like the staff that we're supervising, either diving deeper into and building those relationships, or finding someone else to supervise them, because it's so important that our relationships are genuine and caring and empathic with our staff. The organization really recognizes, that everyone has a role to play, that this being trauma-informed isn't a clinical intervention, it's an organizational culture and perspective. So these are all different ways in which we can start really engaging in a mutual and collaborative relationship, really moving from doing things with people, not for people, looking at our policies and procedures and our hiring, moving to shared decision-making, really opening up and making those spaces welcoming. So this is what it looks like, really, Sitting beside our staff and helping them in their process as opposed to standing over people. The next principle is empowerment, voice, and choice. So how throughout the organization, from a trauma-informed perspective, we talk a lot about that client voice of lived experience. As a supervisor, I'd like you to take that voice of lived experience and recognize that as your staff's voice. How are they experiencing you as a supervisor? How are they experiencing support and the culture of the organization? So some ways we can get at that is really also, through trauma-informed supervision, through embracing motivational interviewing skills in our supervisory relationships, right? Allowing a focus on wellness with all of our staff. So imagine if, as a tone setter in your relationships with your staff, that they filled out in their orientation to your organization not only a wellness assessment, but also let's look at like how staff learn. So do we assess as a supervisor the learning style and practices of our staff? So imagine coming into an organization where they were asking both about our learning style, our wellness, our resiliencies, and that became part of your supervisory discussion. If as a supervisor, we knew whether our staff were visual or auditory, right, or whether they preferred reading and writing in terms of their learning style, we can then tailor our supervision, our training, and everything else to be much more successful for meeting our staff where they are and providing things in a way in which they can feel successful in really learning the information. So looking to all of these different ways to empower staff and really creating that shared vision of the best place to work. When we honor voice and choice, right, we really need to go back to how are we incorporating that into everything that we're doing, wherever possible. Where as supervisors can we provide the end goal and allow staff to have the choice in how they get there. The last principle here, right, is a focus on cultural, historical, and gender considerations. And in our workplace, this is about moving beyond cultural stereotypes and biases and really offering gender-responsive services, leveraging that healing value of traditional cultural connections, recognizing and addressing historical trauma, not only with our clients, but also with our staff, and recognizing that humans bring all of those components to them, when they walk into the work, even in a staffing relationship, not just in a client relationship. So how do we practice as a supervisor cultural humility, really getting to know what drives our staff, what got them to where they are, and really how that influences and impacts not only their relationships, but their work? How do we embrace the concepts of diversity, equity, and inclusion? What I'd like to do is really dive into this in our next section as we look at how do we foster a supportive environment. As a supervisor, as a leader in our organization, how do we really centralize diversity, equity, and inclusion? How do we really start to look even more deeply at the concept of safety, the idea of collaboration without punishment, and then we're going to follow up with Brené Brown's work in her book, Dare to Lead, and really how we bring all of that together. So diversity is about embracing differences, recognizing the amazing things that are possible when they're woven into an organizational culture. So diversity is more than just what we can see. It's more than just culture or race or gender, but really looking at physical abilities. We discussed when I was in the room in Florida, the idea that if we make a space really addressing and embracing all components of diversity, are all of your signs being able to be read by someone who's colorblind? Are there ways that we really need to expand our perspective of diversity? As you can see on this slide, we have job level and perspective thinking styles. We talked earlier, right, about understanding the different learning styles of all of our staff and how we bring that into the fold of our training and our supervisory practices to really embrace all of those different ways in which we as humans show up in the world. So how do we take all of these components and experiences that people bring, the different skills, and really bring them to the forefront? And I would suggest that as a supervisor from a trauma-informed lens, our job is to protect all of these voices, whether they're voices that agree or disagree with us, and in some ways to make a stronger effort to support and protect the voices that don't agree with us, because that's where the richness of the experience really comes into play. So when we look at the slide, right, it moves us through the idea that equality is everybody getting the same supports. But we are so different in everything that we bring to the table, everything that we bring when we bring our full selves, that as we move to equity, right, you see that people are getting adjustment so that they can all see that game over the fence. But how do we as supervisors really move to this justice idea, to this last slide of removing the barrier altogether and allowing everyone to be present with their whole selves? And what a different workforce we would have and workplace we would have if we really start to look at the barriers that we put up unknowingly sometimes. You know, our job as supervisors is to be aware of our implicit biases, to be able to talk about that and provide a space where all voices can be heard through that cultural humility perspective, right? When we talk about cultural humility, the first step is recognizing and being aware of our own perspectives and our own biases, and then being engaged and curious about all of those other humans around us. So diversity is that mix, and inclusion is respecting those differences. And so this gives you a way, right, to start looking at understanding all those different pieces of everyone that come in, and then how do we find a way to empower and engage and enable all of those voices to be heard and engaged in our process as supervisors. So here is that cultural humility piece, right? Aspiring the development of partnerships with people and groups and advocating for others, that lifelong commitment to our own self-evaluation and self-critique, and the desire to fix those imbalances wherever they exist. So again, back to as supervisors, our responsibility to walk this talk and to get to understand our own self first so that we can really be present and engaging and supportive as other people go through their own processes. So professional growth and accountability. How are we creating a system in our organizational culture and our supervisory relationships to provide that ongoing communication and training, whether it's through communication, sharing our policies and procedures, making sure that we're developing our policies and procedures with those who are impacted by them, as opposed to just in our offices because it sounds good or makes sense to us, right? And then how do we, on an ongoing basis, as part of our supervisory practice, develop methods to review and track staff competencies, not just at the end of the year at our annual review, but really as an ongoing embrace that as part of your supervisory practice, right? And recognizing both the principles of trauma-informed care, but also that leadership development, the self-care, the importance of recognizing compassion fatigue and the difference, right, between compassion fatigue and burnout and secondary or vicarious trauma, and creating a space in our supervision and our workplace to really address self-care and employee wellness. And then also it says down here, right, recognizing that this isn't just for our clinical staff, but for all staff in our organization. The other piece that we need to recognize is where not only our supervisees are in terms of their professional development, are they at the early part of their career, mid part of their career, at the later part of their career, and what those different needs are from supervisees from their supervisors. But then also as supervisors, where are we in our own professional development? Are we recently starting and building our skills? Are we mid-level, or kind of are we later in our career? And so as we're looking at our supervisory relationships, we need to recognize where both people are and then how we match those to really bring out the best in our supervisees. So here we have a recognition that shame brought into any workplace really is the killer of innovation and creativity and what brings us alive in the workplace. So how do we make sure that we as supervisors are creating that space of vulnerability as opposed to focusing and working from a shame-based perspective with the staff that we serve? Part of that is helping really start from the idea of understanding why people are doing, why our staff are doing what they're doing. And recognizing here that purpose is really the combination for us as humans of these 4 areas: doing what we love, recognizing what the world needs, where our strengths at, and then what we get paid for. And how do we help staff find the sweet spot for them? Not every job is made for everybody. And so how do we help staff find that purpose? Because that's really where they're going to come alive. So I have this question for you. If we start to look at professional development outside of just our job descriptions, what types of goals, if you can use the chat box area, what types of goals would you guys use, right, to help your staff develop professionally that are not directly related to their job description or performance review? An example might be if you have a supervisee whose goal is really to focus on, they're where they're at in their career. They don't want to move to the next level, but they're really interested in cooking. They're really interested in musical skills. They're really interested in a specific topic area, in history, and really exploring that more. In the chat box, can you guys give me some ideas of how would you start to bring some of those personal interests, not related directly to their job description, into their professional development goals? Okay, so here we have a self-care goal, which is great, right? How do we start to bring in those mindfulness practices, and maybe they can learn some of those and find a way to bring those into, right, the work that they're doing with everyone. Here we also have someone recognizing going into your own counseling, right? So one of the conversations we had was, if you take a really distant idea, like underwater basket weaving, how would you help a supervisee? Like, that's not directly related to counseling. That's not directly related to, their performance metrics. But there might be something about when we start supporting our staff and coming alive in their whole self that brings them back to engaging with us into the work that they're doing. So I would encourage you as supervisors, we have another recognition of someone to focus on their own personal health and wellness and working out. And so, like, having this workout goal, I think that's great, right? But I would really encourage you guys to be, as supervisors, as creative as possible about bringing that whole self into the work that we're doing and supporting people to be present. So here we have a comment, right, that they could relate their joy and their interest to helping clients find their joy. That is perfect. That is exactly what we're looking for, and recognizing that it's not just in that job description. And I think we can become so pigeonholed as supervisors into focusing just on what is in their job description that we miss the piece of just being alive and finding that joy in the work that we're doing. So just really encouraging you as a supervisor to help support your staff in coming alive. And when you do that, the engagement back in the job performance expectations really just multiply. Okay, so let's talk about that importance of engagement, right? And how do we create an environment where this is really where people are thriving in what they're doing? So here's our work with Brene Brown. So Brene starts in her work, really was, and talks about the transitional point in her work, right, from this quote from Theodore Roosevelt. It's not the critic who counts, not the man who points out how the strong man stumbles, or where the doer of deeds could have done them better. The credit belongs to the man who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs, who comes up short again and again because there is no effort without error and shortcomings, but who does actually strive to do the deeds, who knows great enthusiasms, the great devotions, who spends himself in a worthy cause, who at the best knows in the end the triumph of high achievement, and who at the worst, if he fails, at least fails while daring greatly, so that his place shall never be with those cold and timid souls who neither know victory nor defeat. And this is what we are really striving for. We're recognizing that our staff are the ones in the arena putting themselves out there, right? And so Brené Brown really focuses, right, on the importance of really supporting those who fail while daring greatly. And she says the courage to be vulnerable is not about winning or losing. It's about the courage to show up when we can't predict or control the outcome. So within her book, Dare to Lead, Brené talks about these concepts. The first concept is rumbling with vulnerability. So she says you can't get to courage without rumbling with vulnerability. We need to embrace the suck. That courage and fear are not mutually exclusive, that most of us feel brave and afraid at the exact same time. And so a rumble is to listen with the same passion in which we want to be heard. And courage, she really talks about these 4 skill sets that we're going to go over briefly. Rumbling with vulnerability, living into our values, braving trust, and learning to rise. So as we are looking at this rumble, a rumble is a discussion or a conversation, a meeting that's defined by a commitment to really lean into that vulnerability, to stay curious and generous, to stick with the messy part in the middle as we're identifying and solving problems, to take breaks and circle back when necessary. She talks about being fearless in our owning our parts and listening with the passion in which we want to be heard. So when we say let's rumble, we're talking about what you've said has triggered something in me. I'm having difficulty getting through my own filters. And I want to be able to hear what and really understand the message you're trying to share with me. And so let's talk about where I'm getting stuck, and let's talk about what you're really trying to share and share with me in this process. She also talks about loving ourselves through the process of that owning our own story, and that can be the bravest thing that we do. And recognizing that we are who is how we lead, so that the real barrier to daring leadership is really our own armor, our thoughts, our emotions, our behaviors that we use to protect ourselves when we aren't willing to rumble with that vulnerability. And so if we practice self-compassion and have patience with ourselves as we go through this, we are all just human as well as those that we're serving. So how do we show up in that process? So here's a quote from Brené's book, from the book. So she says, courage is contagious. We have to cultivate a culture in which brave hearts, tough conversations, and whole hearts, or brave work and whole hearts are the expectation, and armor isn't necessary or rewarded. We have to be vigilant about creating a culture in which people feel safe, seen, heard, and respected. And that daring leaders, back to this compassion and connection, right? Daring leaders must care for and be connected to the people that we lead. And she goes on to say that this means that if we do not have a sense of caring towards someone we lead and or don't feel connected to that person, we have 2 options: to developing the caring and connection or find a leader who's a better fit. And there's no shame in this. We've all experienced the kind of disconnection that doesn't get better despite our strongest efforts. But understanding the commitment to care and the connection is a minimal threshold, and we need courage to recognize when we can't fully service the people that we lead. But what we can do and what we are ethically called to do is to create a space in our schools and our classrooms where students can walk in and for that hour or day take off the crushing weight of their armor, put it on a rack, and open their health to truly being seen. I would suggest that that's what we need to do as supervisors for our staff as well, right? To never underestimate the benefit of having that place to go, to belong, where if even for 1 hour we can take off our armor, it can also often change the trajectory of our life and of those that we serve. And that if the culture in our school or our organization, place of worship, or even family requires armor because of all of those outside pressures and fear-based leadership, that we can't expect people to be wholehearted and engaged. So in our organizations, regarding those armoring behaviors, guilt, blaming, shaming, cynicism, perfectionism, and emotional stoicism, that we can't expect innovative work. It's much easier to talk about what we want and need than it is to talk about those fears, our feelings, and scarcity. And so how do we as supervisors create that space? And that's the courage that we're talking about in terms of your leadership. So here are those teachable skills that we as leaders can build in ourselves. The first is rumbling with vulnerability. As we talk about, it's how do we look at our own filters and the information and the way that we process and start to be curious about really what the other person is trying to convey and share. So it looks like things like the story that I'm making up about this is, I'm curious about, tell me more. That's not my experience. Help me understand yours, right? Walk me through that. Help me understand your passion around this, or tell me why this thing that we're talking about doesn't fit or work for you. So how as supervisors do we embrace that language to really create that space for those that we supervise? The next one is about really leaning into our values. And when we're clear about what those 2 to 3 values that are really drive us as humans personally, that those are the things that daring leaders can never be silent about. The third is recognizing her definition here of braving. So focusing on boundaries, reliability, accountability, vault, recognizing when it's our story to share and when it's not, that confidentiality in that supervisory and in that personal relationship. Integrity, doing what we say and saying what we're going to do, providing that support in a non-judgmental way, and that generosity of recognizing that our staff are just humans doing the best they can with what they have, and that our goal and our role is really to provide that open and supportive place where people can come alive. The last is learning to rise. And so this is Brené Brown's manifesto of the brave and brokenhearted. So she talks about there being the ability to rise is really where our strength comes. So I'm going to share with you the manifesto of the brave and brokenhearted. Brené says, there is no greater threat to the critics and cynics and fearmongers than those of us who are willing to fall because we have learned how to rise. With skinned knees and bruised hearts, we choose owning our stories of struggle over hiding, over hustling, over pretending. When we deny our stories, they define us. When we run from struggle, we are never free. So we turn toward truth and look it in the eye. We will not be characters in our stories, not villains, not victims, not even heroes. We are the authors of our lives. We write our own daring endings. We craft love from heartbreak, compassion from shame, grace from disappointment, courage from failure. Showing up is our power. Story is our way home. Truth is our song. We are the brave and brokenhearted, and we are rising strong. And when we embrace that, we bring our whole self and the ability to learn from those mistakes and engaging in those mistakes or engaging when things don't go right to become even stronger on the other side. The last piece before the break is just recognizing the impact of this work on those that we serve. And those that we serve as supervisors are our supervisees. So how do we make sure that we're helping staff transform compassion fatigue into compassion satisfaction? And so these slides give you some ideas, right? How do we balance or rebalance our workload? How do we delegate, whether it's at home or at work, and have those transitions? How do we start to develop self-care ideas, taking stock of what's on our plate? Learning to say yes or no more often, assessing our own trauma inputs, right? Recognizing and learning about compassion fatigue and vicarious trauma as supervisors, bringing that in to the work that we're doing, creating wellness plans for our staff and for ourselves, and making sure professionally we're continuing to grow in the areas that are important to us. As supervisors, making sure that we are walking around the office and really being present for our staff, right? Being visible, being with people as they go throughout their day, encouraging staff huddles, making sure that staff have support groups, opportunities to learn, that we're giving staff tools and resources, and really finding ways in which people want to be recognized. Everyone has a different way in which they feel recognized. Some people like in front of larger groups. Some people want very personal recognitions. So how do we understand from our staff's perspective what those ways in which they want to be recognized and their success is celebrated so that they can really feel seen and heard? So, right, here's this recognition, right? What it says is, what's the problem with being the strong one is that no one realizes that we need a shoulder to cry on sometimes too. How do we create that space and allow our staff for it to be okay for them to take care of themselves? So here from kitchen table wisdom, right? The expectation that we can be immersed in suffering and loss daily and not be touched by it is as realistic as expecting to be able to walk through water and not get wet. So again, in your supervisory practice, how are you creating that space, doing our own work as supervisors so that we can be present for those that we supervise, so that we can be there to help support them, not rely on them to take care of us, and really recognize our role in helping people rebuild from that in which they're giving out of themselves every day in the hard work that they're doing. So we have reached the hour mark. And Eric, I'm going to turn it back to you for a brief break.
Yes, we'll take a brief intermission of about 5 minutes. We will return at, let's call it 10:04 sharp. All right, it is now 11:04, and Elizabeth, if you're ready, let's go ahead and get started again.
Sounds good. Thank you, Eric. So we are going to move back to the trauma-informed supervision model. Eric, can we switch back to the presentation slides?
Yeah, let's see what's going on. I have it up on my screen. Do you still have the intermission slide?
I still see the intermission, yeah. There we go.
Let me try to re-hand off.
You. Yep, I got it.
Perfect.
Thank you. Okay, so we're going to spend the second hour on talking about the specific components of IF supervision and the specific skills that from a trauma-informed practice, we really want to make sure that we're attuning to and really focusing on. So when we start with the components, we've got them broken down into our administrative components as a supervisor, the practice level components, and those reflective supervision components. So as a supervisor, right, part of what we do is provide those performance reviews. And as we mentioned earlier, not only making sure, right, that we have in our performance evaluations a nod to the individuality and uniqueness of those that we serve as supervisees, and making sure that we're recognizing, goals that make them come alive outside of that job description. We also want to make sure that they're timely and meaningful, both in the data and in our reviews. So how do you make sure in your supervision notes that can help kind of guide your process, that you have quarterly goals, that you're not just reviewing once a year, in this huge time period in which so much occurs, how staff are doing, but that we're giving ongoing, consistent review feedback. And so it might look like making 3-month goals and having them at the top of your supervision notes and practices to really focus on every supervisory session of how are we keeping people on track to really be successful in their work and in their professional development. The other piece that I would say about that, and we bring this in with the clear expectations as well, right, that we develop goals with people as we do with our clients. So how do we make sure that the expectations are clear, that the measurements that we're using, that we come up with together, so that we're not spending all of 6 months of a review process discussing and trying to understand where the data came from. But the clearer, the better, as Brene Brown says, and we referenced earlier, right? Clear is kind, unclear is unkind. And being trauma-informed really is about increased accountability as opposed to removing accountability. But we have to do that with being really clear, painting it done, as Brene talks about, being really clear what the end result would look like for us to consider our staff in meeting our expectations. The better that we do that clearer and better that outcome is, because they know without ambiguity what they're striving to achieve. And we also look at that importance of accountability and recognition, right? That when our staff are really succeeding and stepping above and beyond, that we are recognizing that. And again, in an individual way, that someone feels recognized. I, as a supervisor, had a group of staff in a department that was much smaller in the larger agency. And one of their feedback to me was, we do not want to be recognized in those large organizational meetings where there are 5 million people, and it just feels like it gets lost, that it's much more meaningful to us as a team if in our one-on-one supervisions or in our individual groups, we recognize our successes. And so we set up a process in which we made sure we were doing that. In another organization, staff didn't feel really recognized by upper management and leadership. So we set up a process in which they could be recognized, and leadership at multiple layers above them had a way to access the great work that people were doing on a daily basis and a way to circle back for the chief level of that organization to respond to the direct line staff and really recognize and honor when they were really following through and going above and beyond within our values. So these steps to accountability, right? Self-honesty, valuing others, making sure that we're keeping records of what people are doing and successes in areas of struggle so that we can honor those, taking responsibility for not only when things go right, but also when we have those learning opportunities and things don't go so right? And acting really promptly with care and compassion. So doing that and being present is so important as part of our role as leaders and supervisors, is holding staff accountable to the things going well and the things in areas of improvement or weakness or challenges, and really being comprehensive, right? Seeing the whole person. As a supervisor, part of your job is to provide training. Whether we're doing it consistently within our supervisory practice, whether we're making sure that we're having a comprehensive training within our organization, but part of your role as a supervisor is training your staff. One of the struggles and one of the comments I've seen before is, a supervisor saying, or leaders saying, what happens if we train our staff and they leave? And then the recognition of what if we train our staff and we don't train our staff and they stay? Your job is to professionally grow all of those who report to you in that supervisory capacity, and recognizing that only builds the strength of our process and our practice. And if people train and then move on, then we've done a good job and we've created and really grown people professionally. We might not have an opportunity in our organization, but they then become a voice and a partner in our community with us, and that only strengthens across our community the resources for our clients. That learning mindset we've talked about, right? The idea that things go wrong, that we make mistakes, and that we learn from those mistakes as a supervisor as well as our supervisees. So recognizing where we've made mistakes, recognizing where we've learned from something, taking ownership for that in a non-shaming, non-blaming way, but really as opportunities, that we create reviews of where cases didn't go well and what we can learn from that, as opposed to staff feeling like they can only present those different types of really specific, great outcomes. Professional development. Really focusing on that coaching and training, the personal growth, as we've talked about those identities, right, or the identifying goals not related to your job description, allowing people to say, I want to grow and I want to look at these other opportunities, and having open and honest conversations and supporting our staff, even if that opportunity for growth isn't within our organization. Again, those would become your allies and advocates in the community. And frequently, you'll see those staff return into higher levels within our organization because we have provided that open and transparent relationship. Learning, recognizing experience, and really skill building. Are we clear in our job descriptions about the different skills that it takes to be a direct line staff and a supervisor? Those are very different skills. And so if in our job descriptions they're outlined, then we can help train to that and build to that and help people move and grow in the areas that they want to. In Dr. Ablon's work of collaborative problem solving, so this is an evidence-based clinical practice, trauma-informed practice that we can use in our practice with our clients. It also suggests, and I know that Dr. Ablon supports, bringing this practice into your supervision. So how do we recognize in collaborative problem solving the power of recognizing when our staff have been triggered into fight, flight, or freeze, and helping regulate them back so that they can help access higher functioning levels of their brain, right, so that we can really get to a problem solving in a collaborative way. The next step after we've helped someone regulate, if they've become dysregulated in a supervision session, is to then relate. This goes back to Brene Brown's comments about we have to have compassion and caring for those that we serve. And if we don't, it's not really ethical practice to stay in that relationship. So we care about those that we serve, we're engaged with them. And so after we help them regulate, if they've been triggered, right, we relate back and connect back with them, and then we start talking about the problem or issue that we want to resolve. And if someone becomes dysregulated again, emotionally, because we're all human and that happens on a variety of different ways and levels, going back to helping someone regulate, go back to your relationship, and then come back to the cognitive process that you're working on. And so this is this collaborative problem-solving process, right? Plan A is as a supervisor, what we want people to do. Plan C is the way that they want to do it. And Plan B is that collaborative process in the middle, or as Steve Covey talks about, right, really that win-win proposition or no deal. How do we make sure that both our needs as supervisors in terms of meeting goals or objectives or productivity or whatever the issue is, the staff's perspective on, I really don't want to do my notes, I just want to see someone and move on, and find a place in the middle, that collaborative process, right, to come to a way to get to that win-win or no deal process or place. Reflective supervision, right, this is about supporting your staff in their professional development and understanding what they bring as a whole person and what hinders their change process. This is not about therapy, but recognizing the whole person that they bring to their professional position and what gets in the way, and allowing people to be human in that relationship-based supervision session and really bring all of themselves to work that they're doing. The other piece that we want to do is focusing on wellness, right? How do we make sure that our staff are able to take care of themselves, whether it's in the environment we're creating. If we talk about a wellness an organizational culture of wellness, right, are we supplying, if we supply food to a meeting, are we making sure that those are healthy and nutritious options for our staff so that they can be healthy, or are we continuing to just provide pizza and soda and then preaching about being wellness? Are we allowing staff to take those breaks, to find places where they'll thrive and come alive, to really engage in the work that they're doing and be open to different opportunities for them to do that? We also recognize, as we've been talking, that a person brings their whole self to work. And so how do we recognize that and honor that and encourage that in all the uniqueness and diversity that that means and brings? Also making sure as a supervisor that we're providing safety and respect in the responses that we give to people. But if we're triggered by something that our staff have said, how do we take a moment to breathe and also regulate ourselves so that we can be present and connected in our relationship in a way that's respectful and provides a safe place for staff to be their whole self? Making sure that we're educating staff not just about those that they serve and signs and symptoms of trauma, but also how are we educating staff about the impact on them of trauma and what signs and symptoms they need to recognize in themselves, helping people identify and be able to verbalize to you, if I am doing X, Y, or Z, that means I'm starting to fall into compassion fatigue as opposed to compassion satisfaction, and that we might not always see it right away in ourselves. So how do we make sure that as a supervisor, right, we're creating that space for staff to be open and transparent with us so that if we start to see signs and symptoms in our staff, we have a place to address that and provide a place where they can then do something about that in a different way. The next piece are these supervisory skills. So administratively, are we providing disclosure statements? And what's the purpose and function of those? Are we following data-informed decision-making practices, ensuring diversity, equity, and inclusion? In our practice, are we creating that holding environment, that safe space, sacred space in the supervisory relationship where staff get filled up, where staff get their needs met so they can go back and do the incredible hard work that we're asking them to do every day? Are we engaging in active listening, listening to understand as opposed to listening to respond? Are we practicing motivational interviewing skills in our work with our staff and bringing and embracing the spirit of motivational interviewing, working on collaborative problem solving, right? Identifying practicing reflective skills, identifying adaptive challenges over technical challenges, building in relationships, that compassion, resilience, managing conflict. Are we able as supervisors to sit in that space and focusing on values? So a supervisory disclosure form, and at the end of this presentation, there will actually be an attachment for you guys to access that is a trauma-informed supervisory practice handout. It has both examples of trauma-informed supervision notes, 2 examples also of the supervisory disclosure forms, and I want to kind of pause on these and we're going to talk about them. But it also will give you guidance on developing your own supervisory practice in an organization. Definitely recommend that you determine what your supervisory experience as an organization should be. What should everybody who comes to your organization experience in supervision? Look at the principles and practices within trauma-informed care. Develop a trauma-informed supervision note. Develop a disclosure, your supervisory disclosure statement for every supervisor across your organization. And then bring all of your supervisors in and train them both to the principles and practice of trauma-informed supervision, because it is for any human that we are supervising, and then to the disclosure forms, or the disclosure statements and forms and your supervision notes, and then roll it out across the agency so that you really have this consistent practice, as opposed to just adding, here's a new note form or here's a new process that we're using without really educating so that everybody on that philosophy. So a supervisory disclosure form. So this gives the supervisor an opportunity to write down, who am I as a supervisor? What's my philosophy of supervision? What's the experience that I bring to the supervisory relationship? What are my expectations of the supervisee, but also what are my responsibilities in the supervisory relationship, so that staff know what I'm held accountable to and what they should be getting. So if they're not getting good supervision, we can do something about it. And that opens up, that collaborative, transparent relationship. How often are we going to be meeting? What are the goals of our supervisory sessions? And then also attaching your supervisor and your job description and your supervisee's job description. This allows for everything to be above board. If I expect as a clinical supervisor for you to bring 3 cases every day or every supervision session, I want to have that in my supervisory disclosure form. If my goal and expectation is that you're going to either walk in with or I'm going to help you develop your own clinical practice, theoretical practice, of your work, then put that in your as part of your expectations of your supervisees and relationships and what you expect to come out of this relationship. These then should be for all supervisors across your organization, your CFO, your director of your maintenance staff. Everybody in a supervisory role has a perspective on how they see that supervisory relationship, what they bring to that and what they expect. So the more open and transparent we can be, the better across the board. Now imagine having all of these supervisory disclosure forms open and available to any staff in your organization. So people can start to look at, I want to move into this other position. I can pull someone's supervisory disclosure form and know what I'm getting into, know what they would be expecting, and if that's the right match for me in terms of supervision and where I am in my own process. It also can be open to our clients. so that, again, we are not mysteries as supervisors, but really open and transparent about the whole process. This also allows for that practice of 360 evaluations in which our staff review our performance to our supervisor so that everybody is accountable and open in terms of the expectations. The next is focusing on data-informed decision-making. So the difference between being data-informed and data-driven is that if we're data-driven, then the data is the only thing that we take into account. If we're data-informed, then we really take into account that and other sources of information to help start to make decisions. Either way, when we focus on data, we want to make sure that the metric, right, is a good metric to start out with, that it's actionable, that we all have access to the data and the data is credible, that it's simple and transparent. And this goes into spending more time developing the measure with our staff as opposed to presenting measures that we spend way too much time trying to explain because of the complexity of the calculation. And then allowing for that common interpretation that we all know what we're talking about when we look at this data and this information. So we need to recognize, right, that the first law of quality improvement in that data development is that every system is perfectly designed to achieve exactly the results that it gets. So if we want to change the results, we have to look at changing the system. And that's part of that process, right, of being open and transparent and having everyone engaged in the development of the outcomes that we're looking for. So this gives you some of those pros and cons, right, the difference between data-informed and data-driven, right? So that data is a factor when we're data-informed into our decision-making process rather than the entire basis of our decision. So the pros of that is we recognize, right, the limitations of our available data. We use multiple sources for data decision-making, and we can be more creative and out of the box in terms of our results and our interventions. The cons is that it can sometimes be less efficient if we take multiple voices into account and can, if we don't have a clear data process in immature organizations, it can kind of decrease our focus on the need in our world now, in our professional world, to really have clear and ongoing data metrics that we are overseeing. Right? So making sure that we're data informed right in that decision-making process and that we see data as part of a portion of that larger picture in the work that we're doing. So 3 ways that we can really start to impact that is to connect the data specifically to our mission, to make the data meaningful, and to make sure that we're effectively really communicating about that data on an ongoing basis. If it's something we pull out just once a year at an annual review, it really is not a way to engage data in our daily decision-making process, right? So we want to make sure that our measures are indicative of and showing, right, the improvement of the efforts that we are in a desired direction, that they're reliable, practical measures, they're simple and meaningful, and that we can accomplish them very simply. When we use those, then we can move past the discussion about where the data came from and start to really talk about what the data is telling us in a comprehensive way. Different ways in which we can get data in our processes is both quantitative and qualitative. So quantitative, right, are really those numbers piece, and qualitative are really those senses, right? What can I hear, see, smell? What are the different, all those different inputs, right? So it might be, gathered through a focus group or client reviews. Do clients have a way to review their sessions with our supervisees? Expert opinions, outside consultants, interviews, different types of surveys. We talked earlier about the idea of looking at a practice, our own practice, right, about keep, change, start, and stop. using that as a way to talk with staff or with clients, right, about here's where we're trying to get to that end. What do we need to keep, change, start, and stop? Those would be qualitative data points. So then we also need to look at those outcomes, right? The degree to which the organization accomplishes its stated aims in aligning with the purpose and mission of the organization. Is this data and are these goals and outcomes and job performance metrics really related to the overall mission of the organization, in an arching way, connected to your strategic plan as an organization, the goals of developing evidence-based practices or things like that, to really make sure that we are across the board having meaningful outcomes, right, that they benefit those who are receiving our services, and really focusing on that quadruple aim in healthcare, right, that our patients are satisfied with their experience, their outcomes overall are better, their health outcomes, that the cost to the benefit of the cost ratio is high, and that our staff's experiences, the provider group, right, is really meaningful as well. That's the quadruple aim. We have to remember also to communicate our data. As supervisors across the board, we can never communicate enough about everything that we're doing to our staff. So communicate, this reminder, right, 6 different ways, 6 different times. And celebrating those successes help reinforce the mission and the work that we're wanting to do. So share that information, include it in your feedback with your team, right? Celebrate those successes, and also where can we learn in a data-driven and data-informed process, where can we learn from the data, what's it telling us, and how do we get better at moving those metrics. So also a recognition, right, of that ongoing need for evaluation. We don't want to get into the place where we're only evaluating performance once a year. It's just not meaningful. So making sure that we recognize those small changes, that ongoing quality improvement process, right, that we try something and we look at the outcomes and then we learn from that and try something and continue to try something new, incorporating that ongoing feedback, right, that we're including everybody in that process so that we can really have a robust and really good sense of overall performance improving at the end of the day. So question for you guys, and if you can respond in the chat box, right? So what is meaningful data that you guys have that you could start to bring into your ongoing supervisory practice? So if we think about frequently we capture encounters or we capture productivity reports or billing reports, if we think outside of that, what types of other data could you be bringing in? So we have a mood chart, sure. After each session, really starting to look at, right, how the clients are responding in different ways. So I see a session rating scale, right? What are some of the other things? Homework completion, there you go, right? How are we really looking at engagement? I would definitely suggest that just because someone shows up for a session, it doesn't mean they're engaged in the session, it just means that they showed up. And just because someone didn't show up, our no-show rates, I would venture that doesn't mean they're disengaged, right? There's so many things that get in the way of getting to appointments, that looking at some of these things, right? I love the mood chart, I love the homework completion. There we go, feedback forms and surveys, right? Suggestions about how we can improve things. Having those as regular outcome results, and that qualitative and quantitative data, right, that we can bring in on a regular basis to make our supervision sessions really productive and engaging. Client surveys, talking about safety are some of the things that you guys are adding in. I think those are all great and so important. So again, as we talked about a performance goal that was not related, right, to your job description, really as a supervisor, pushing yourself to get to meaningful data. And I would encourage you to start with asking those that you supervise how they would know they were doing a good job and what kinds of things we want to start looking at on an ongoing basis. So thank you for sharing those things that you guys added in. So we talked right earlier about the importance of diversity, equity, and inclusion, and your job as a supervisor to create that safe space, right, in which we protect all voices. And as I said earlier, I really err on that, even the voices, even more so the voices that are difficult for us to hear as supervisors, right? So here we've got diversity as the quality of being different or unique at the individual and group level, equity, the pledge of fair treatment, opportunity and advancement, while striving to identify and eliminate barriers. And then the inclusion is that act of really bringing everyone together and harnessing those differences in a way that's beneficial. Creating the space for those complex and robust conversations with our staff to learn through those interactions is really where we benefit so much from diversity, equity, and inclusion as a supervisor. So figure out, guys, what are, as a supervisor, as a human, right, what your difficulties are, where your struggles are, so that you can really embrace diversity, equity, and inclusion in your group. Where are your blind spots? You know, where do you get stuck up in your own practice in moving this work forward? And then how do you, as a, bring that humanity to your supervision relationships and your team relationships to really broaden these conversations? So practice skills, we're really talking about, being able to reenact client sessions in your room and practicing, giving staff really that opportunity, right, to practice all of those different things, listening to understand in session, empathy, relating to clients, practicing sitting in silence, and giving our staff really a place to hone in on those skill development. Creating that holding environment is going to be so vital for our staff to practice those skills with us, right? That we create an idea, a place where we can talk about adaptive challenges. So it's not the technical things of I didn't fill out the form right or things like that, but really how we manage change and pivoting in the room and in the space, as opposed to just focusing on the technical pieces of our work. Technical is much easier to stay in. Adaptive is more challenging. And so really embracing as a supervisor the difference between adaptive leadership and technical leadership, and then moving into that space and supporting our staff. Really, that diversity of opinion is welcome here. We want to encourage our staff to disagree with us, to have robust conversations, to get to the other side so that they can be fully present in the work that they're doing with our clients. Experiences and values and assumptions are shared and challenged. The frequent question of, well, why do we have to do it that way? Why does this have to happen in that way? And really pushing all of those different beliefs and assumptions. And that stress is expected and tolerated. We are going to be uncomfortable if we have difficult conversations, and that's okay. And how, as supervisors, how vital it is that we get comfortable in our own stress, in our own challenges, so that we can be present for those that we are called to serve in a leadership capacity. Active listening. So this is a skill, and I would challenge us to look at this in a bit of a different way than just reflective listening, and even the way we listen in a reflective manner, right? So listening to understand, not to respond, including all of your senses, including active exploration and interest and tell me more, help me understand, expand on this component, long before we as supervisors step in to engage in sharing any information. And one of the hardest lessons for me as a supervisor was that sometimes in the room, unfortunately, whether we want to or not, our voice or our opinion trumps everybody else's. And so people start to shut down if we as supervisors start sharing, well, I would do this, or I think we should do that, or what about this, even if that's our own process, right? And when we see our voice as equal in a discussion, those that we supervise don't always see it that way. So really getting to understand our supervisee's perspective without jumping in with our own is vital to developing that trusting relationship and that holding environment, right, for a safe space for staff to explore who they are. And when we do that, we convey an investment in the relationship with our supervisees, as opposed to just come in and let me tell you what to do. Let me tell you how impressive my credentials and my experience are. Even if they are, that doesn't help our staff and our supervisees develop who they are. So the first step to active listening is reflective listening. And so it starts with just listening to understand, paraphrasing what I heard you say, and then verifying, is this what you meant? The last piece of this is really practicing, right? What I heard you saying is this, am I correct? And then if they say no, how do we move back to, okay, what did I miss? And going back through that process. But when someone says they've said everything or that I heard you correctly, here's the vital question. Anything else you'd like to add? We are in a culture that is so fast-paced that we work really hard to share all the information up front so that we don't get stuck in missing an opportunity to share a piece of information. But if I allow you as the listener to take as much time as you need to convey all that is important to you before I respond, now I'm engaging in giving you space to be your whole self. So once we've gotten through that process and they really have said that's correct and there really isn't anything else, I've gotten everything that I wanted to say out, and you've really understood what I've said before we've even responded, then we move to how do we respond. So here are the rules for active listening. We can only respond to what we've heard. So we can't share our opinion if it wasn't asked for, and we can't answer a question that wasn't asked. So how often as supervisors do our staff share an opinion and experience, and without asking for our opinion, without asking for our direction, we step in and give it? Because we find ourselves in that place of, well, that's my role as a supervisor. And I would argue it might not be. But our job is to create that space for our staff to find themselves. And so when they want our opinion, have them ask for it. And if they don't, then our job is to just be witness and to their learning and to their process and their perspective. And that's hard. So I would definitely encourage you as supervisors to find people to practice this active listening with. The next piece is bringing in, right, the motivational interviewing spirit. This is something across the board we usually train within our practice. And so how do we make sure that we're also honoring that, right? Partnering, getting to that emotional piece, sharing compassion with what's been shared, and acceptance of where someone is so that they can find their own motivation for the work that they're doing. So recognizing that motivation isn't stagnant, addressing that ambivalence is a normal part of the change process, that when we push too hard, we get resistance, and that when we talk in a person's own change language, right, we can help enhance their behavioral change. So there's an issue going on. How do we sit in that motivational interviewing spirit space with our staff to help them find the way out as opposed to always providing it for them? So this slide provides you with the difference between technical problems and adaptive challenges, right? The technical problems are easy to identify. They often lend themselves to quick and easy solutions. They can be solved by just an authority telling you how to do something. they require change in minimal areas, that people are generally receptive to technical solutions. You put it on the wrong form, we need to, you submitted it to the wrong place, you didn't get the note in on a certain time. Adaptive challenges, these are more difficult to identify and very frequently easy to deny. Oh, that's not really what I meant. That isn't what, it doesn't look like what you think it does. But it requires a change in sometimes our values, our beliefs, our goals, our relationships, or how we approach our work. And that people with the problem do the work to solve it. Back to that motivational interviewing piece, right? Back to that reflective listening. If you're not asking from, if you're sharing your own process, then you're the one that needs to take ownership of solving that. I can help you as your supervisor, guide you in that process to finding your solution. It's not necessarily up to the supervisor. It isn't up to the supervisor to provide the solution. They can require change in numerous places, usually across organizational boundaries, but people can often resist even acknowledging adaptive challenges because they're more nuanced, and so it's difficult to sit in that space if we haven't created an environment that's really open to being vulnerable with our difficulties and with our whole, how we bring our whole self in. And then back to that learning place, right, that solutions require experiments and new discoveries, and that can take a long time. And so how do we start to implement that? The other piece is recognizing compassion fatigue. And we've talked about this, the work that our staff are doing is hard. So how, as supervisors, do we create a space to help staff rise above, to help people lift up, and to recognize when people are following down a path of, that secondary trauma impacting them, or moving to a compassion fatigue and potential burnout place. The other piece is as supervisors getting comfortable with managing conflict. Conflict will occur, and how do we embrace it as part of our process and learn from it on the other side? Focusing on our own core values will help drive the work that we're doing and really recognize where some of our blind spots are. So I want to give you an opportunity to just take a moment as we talk about all of this different work. What are you hearing in today's webinar that you feel like, as a supervisor, you're willing to either keep doing, change something that you're doing to get further along that trauma-informed supervision path, start doing something that you've heard today that you think, wow, I really need to include that in my supervisory practice, or something that you need to stop doing. I want to give you a chance to, in the chat box, to give us some ideas of kind of what are you guys thinking about. So I see a self-care plan. Oh, great. So that reminder, right, that it's not our job to solve the problem, that sometimes people are sharing an issue. Focusing on wellness and self-care. I'm curious, is anyone in your own practice looking at the learning styles of your staff? Is anyone incorporating that into your supervision practice and leadership styles, or organizations that are really focusing on understanding staff learning styles prior to engaging in supervision and training? I find that that's an area that we don't pay enough attention to as supervisors. Oh, so true colors. Comprehensive professional development. 5-year plans I see that people are doing, incorporating personal needs and professional interests. In the work, they're in the attachment that you guys will find. And if you can't find it, my contacts will be at the end of the slides. Please reach out to me. How do we set up a supervision note that really starts on those strengths and professional goals? Someone has looked at integrating those learning styles. Thinkers versus feelers. Yeah, that's a great way to start that conversation. Strength fires, Myers-Briggs. Yeah, it looks like you guys are using a lot of creative ways to really start looking at all the uniqueness that the humans that we supervise are really bringing to, their to the work that you guys are doing. I think that's wonderful. We can't, just keep growing and continuing to do things. So someone does seek feedback on how they're being supervised, what's working and not working. That's great. Really being open to that. So appreciation language, love language, physical touch. Someone recognized that they removed that. Absolutely, we can never touch anyone without permission. That's great. They have staff taking the language of appreciation in terms of recognizing how people really want to be recognized and acknowledged for the work that they're doing. I think these are all great things. I encourage you guys to keep doing that. So I want to recognize also and take a moment for you guys to recognize as a supervisor that the most important thing that you bring to the work is yourself, and that your own individuality, your unique perspective and personality, your own weaknesses and quirks, and all of your strengths, and to take a time to make sure that you're also honoring and finding places to fill yourself up and honoring what you bring. So in conclusion, we want to recognize our own humanity in those and all that we serve, especially those that we serve as supervisors, that we're all trying the best we can to just survive. But frequently what we observe are these misplaced coping strategies, and since we're all part of the problem, that we can be part of that solution. So please be patient and persistent with those that we serve. Convey respect to all humans that we're interacting with. Be validating and affirming. Seek to understand our staff needs and respond appropriately and accurately. Make sure that we're setting realistic expectations and goals, providing ongoing choices and support. Be clear about what your role is. Follow through with what you say, and make sure that we're providing consistency to those that we supervise. They're doing really hard work every day, and the more we can support them in that, the better outcomes for both our staff and our client, and really minimizing those surprises. So we have a little bit of time left, and I just wanted to open up. Thank you guys for the 2 hours of your time today, and open up to any questions that you guys have in this last bit of time together. So we have one question here of what if staff tell you that they want you to provide an answer because you're the supervisor and they're not interested in learning or doing better? What I would say is that different environments work for different people, and that's neither good nor bad. It's just a recognition that if you are creating a learning environment, and if part of your goal in supervision is to help people find their answers and their selves, and someone says they're not interested in learning or doing better, that might not be then the right fit for your organization or for you as a supervisor. And so they might need to find a different opportunity. It might be within your organization, or it might be outside of your organization, and that's okay, that not every job, not every organization is the right place for everybody. And when we move to an organizational perspective of trauma-informed care, in terms of implementing that as our culture, we do find that it's not the right fit, and we do lose some staff in that process. But if we're clear on the hiring process coming in, we have a better retention going forward because staff have bought into and are entering a culture that is meaningful to them. Let's see if there are other questions. Where can you find the Daring Greatly quote by Theodore Roosevelt? So it's all over the internet and in a lot of Brene Brown's work. You can absolutely find that full quote in a variety of different ways. But yeah, if you just Google Brene and Theodore Roosevelt, you'll usually, she uses it so much, you'll usually find that pop up. Someone said that they're struggling with getting their leadership to understand the importance of supervision versus managing. So we do a lot of consulting regarding the transformation to becoming a trauma-informed organization, and it is really a top-down. We have to get leadership involved. The CEO has to drive that culture. And so if you're struggling with that, I think there are a variety of different ways in which we can what we call communicate for buy-in. So finding the things that are important to your boss or your CEO or your leadership. If they're data-driven, we can look at a lot of different staff engagement and staff retention that comes out of moving to consistent trauma-informed supervision rather than just that idea of managing people. So tying it back to the outcomes that are important and then providing it as an opportunity and a solution to improve those concern areas is one way to start engaging our supervisors or our leadership in our organization about doing something differently from a trauma-informed perspective. But definitely an area of struggle, in a way to an opportunity to figure out what their pain points are and how to provide and speak to those through trauma-informed supervision or the supervision practice as being an opportunity to improve the outcomes for the staff.
Well, thank you, Elizabeth. A great presentation. I got a lot of terrific feedback. I did want to mention, if you want to send me the handouts that you had mentioned earlier in your PowerPoint, I'll try to post those on the website as well. And to all the listeners out there, I sent a link in the chat to where you can find all of our rebroadcasts and PowerPoint materials, as well as this one, and they should be posted within 30 days. And I'd again like to thank Elizabeth for doing this wonderful webinar. Thank you so much.
Thank you, Eric.
I have some administrative stuff to go through, so we conclude, and then we will all be done with very educational webinar. When I conclude today's webinar, your browser will take you to an evaluation on FATA's new website. If you want to receive CE credits or a statement of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for FLA Florida licensing, healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and a number the first time you register. After you register or sign in, you will be directed onward toward the evaluation. You may consider using the same email address when you register for webinars through our WebEx link and when you set up your profile in FATA system. This helps connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today in about 30 minutes. The sender will be Messenger at WebEx. Evaluations will close at midnight on Friday, December 13th. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. Thank you for participating in today's webinar. We'd also like to thank and recognize especially the Florida Department of Children and Family Services of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and please hold for the evaluation.